Good morning, everyone. I shall be speaking on instrument sterilization, cleaning and sterilization. Infection following ophthalmic surgery can lead to permanent vision damage and functional disability that we all know. And a major source of infection in eye surgeries are the very instruments that we are using during the surgeries. And therefore, proper cleaning and reprocessing of the surgical instruments is of utmost importance. So the reusable instruments that we use are usually made of stainless steel or titanium, and alloying is done with chromium, nickel or molybdenum to decrease the risk of rusting. Because if there are rusting and stains and irregular surface, then the risk of debris and organic matter deposits increase, and these actually hinder the sterilization process and also inactivate some of the disinfectants. So for the care of the instruments, these are the process that is being that is followed in the. So coming to the inspection.
Switch off the sound, please.
Coming to inspection, after surgery, each instrument from the set should be carefully scrutinized for defects, debris, etc. under a magnifying loupe or a microscope. There should not be any tissues, blood, irrigating solutions, viscoelastics, medicines, etc. dried on the instruments. Especially the special care should be taken for the cannulated equipments. After a case is finished, blades are cleaned and cannulated instruments are flushed at the point of use and then immediately washed under the running water and followed by a cleaning by 4-bowl technique or in an ultrasonic cleaner. The instruments are double dipped in chlorhexidine cetrimide solution in 2 trays for cleaning and then in distilled water 2 trays for rinsing. So tray 1 5 minutes, tray 2 10 minutes, tray 3 10 minutes and followed by tray 4 10 minutes. Instruments are placed in chlorhexidine cetrimide as I said, and thorough cleaning of the instruments with the help of a toothbrush is done to remove the debris, because sometimes the debris gets stuck and some brush sort of thing should be used to clean it. Should not use any metal brush, steel wool or abrasive powders for cleaning because they destroy the surface of the surface finish of the instruments and enhances the corrosion part. Joints, locks and serrations in the instrument must be cleaned well, and because these are the places where the debris deposits and these are the places where corrosion starts. We use enzymatic cleaners or proteases. This indication is in a case of excessive debris and in case where immediate cleaning of the instruments was not possible. So many enzymes are available like rapid multi-enzyme cleaners, etc. So instruments are dipped in the solution for 8 to 9 minutes, and it's very important that when we use these cleaners, it is very important that it should be rinsed properly and dried well afterwards. Ultrasonic cleaners, these are high frequency sound waves which dislodge the tissue and other particles adhering to the instruments while it is soaked in distilled water or recommended solution. And while keeping the instruments, we should take proper care that these are placed in the baskets and they should not touch each other because otherwise it will get damaged. It's followed by drying. The instruments are dried by aeration or hot air. All the moisture should be removed before sterilization. They should not be wiped with a cloth. That is important as it may damage the surface finish and sharpness. Next is the storage part. Surgical instruments are usually used as a set like cataract set, etc. And one set should be placed in the respective trays on a clean linen or in the silicone mats that are available. Trays and instruments can be marked in similar codes so that they are not interchanged. Pointed tips of blades, scissors should be tipped with plastic sleeves. One more important thing is the lubrication. The moving parts, joints, locks and catches of the instruments, they need lubrication. Surgical grade silicone or Teflon are available. Instrument should be free of all debris before it is being lubricated. Packaging, all instruments need to be packed before sterilization so that sterilization is maintained after the procedure is completed. The packing varies depending on the method of sterilization that is used. For steam autoclave, we use this cloth for packing. For ETO sterilization, these are placed inside plastic packets and then sealed and then sterilized. Steam sterilization or autoclave is a dependable, non-toxic, inexpensive, sporicidal method of sterilization, and it can penetrate the fabrics as well. Then there is dry heat or hot air oven, then ethylene oxide, which provides low temperature sterilization for heat sensitive articles. So for heat sensitive articles, ETO can be used. Autoclave should be a horizontal autoclave, and chemical sterilization is usually not recommended, and flush autoclave can be done in between cases as per the AIO's guidelines. Steam autoclave instruments, these after the autoclave is done should be used within 48 hours. Autoclave it's done for 5 minutes holding time in high speed autoclave, and in regular autoclaves the holding time would be around 20 minutes. The instruments are cleaned in distilled water using the 4-bowl technique. Ethylene oxide gas sterilizer, as I said, for heat sensitive instruments this can be used. Disposable surgical blades, trifines, retinal probes, lenses, drapes, etc. It can be sterilized by the ethylene oxide. But we should be careful that it's a toxic and potentially explosive thing. So due to its toxic nature, an aeration period of minimum 72 hours for the sterilized items is a must before using the instruments. A microbiological control or a biological indicator is mandatory, and the sterility is usually maintained for a year if it is in the original packing. Also available is hydrogen peroxide plasma sterilization, but it's a bit expensive one. So coming to the indicators, these are basically measures for the efficacy of sterilization. Helps to keep a record of the sterilization process and sterility achieved, and their indicator tapes are put where the tray number is mentioned and autoclave number and date are mentioned. Coming to the operating room and corridor, no sweeping, only dry dusting should be done. Daily OT floor is wet mopped with 1% hypochlorite solution using 2 or 3 bucket technique. Hypochlorite should be used should be prepared just before the use. Fumigation also can be done, though there are various opinions about that, but still in India many people are using fumigation, permanent fumigation. And next is the carbolization. New OT, at least 3 fumigations on consecutive days and 3 negative cultures. Running OT once a week. If load is very high, more frequently it can be done. At the end of surgery of a grossly infected case. Other agents are also available which are less toxic, like Bacillus racent, EcoShield, etc. Followed by daily UV irradiation for 12 to 16 hours is also recommended, and this is important that it should be switched off 2 hours before entering the OT. Microscope should be cleaned with 15% cetrimide and 3% chlorhexidine gluconate daily, except the lens part. Microscope knobs should be autoclaved and changed after every use. Lenses should be cleaned with lens cleaning solutions on a weekly basis. Tables, saline stands, and surgeon sheets should be cleaned with 1% hypochlorite or antiseptic on a daily basis. Fans, lights, etc. inside the OT should be wiped once a week with diluted 1% sodium hypochlorite, Savlon or soap water. The OT walls should be washed. Tables, trolleys, etc. should be washed with detergent on a weekly basis. Tables, saline stands, revolving chairs should be cleaned daily with 1% sodium hypochlorite or antiseptic. Also, the AC filters should be cleaned once a week with detergent. Servicing of the AC should be done every 3 months. Finally, the documentation, it's a very important part. Each and every step of the sterilization process should be documented with the name, date, number, and with the signature. So sterilization, surgical instruments should be sterilized after every use, every case. Instruments once opened is considered contaminated, whether it's used or not. Sterilization techniques should be followed strictly. Each and every step should be meticulously followed. Regular maintenance of sterilization equipments is essential for their proper functioning. Indicators should be used with every set, and documentation of each and every step with date and signature is a must. These are some of the references. Thanks.
We'd be happy to answer the queries